Well, good afternoon, everybody, and welcome to our COVID-19 Lunch and Learn with Regina Carswell Russo and Dr. Nita Walker from UC Health. I'm going to be keeping an eye on the waiting room to make sure that I invite all the guests as they come in so they can join the conversation. But a few weeks ago, we did a survey of Easterseals staff just asking folks about their comfort with vaccination, and there was a mixed response with some folks that we sensed that there was still some hesitancy even among staff about getting vaccinated. So felt like it was a very appropriate conversation to have to invite people to submit their questions. And if you submitted one and you're on the call, I want to say thank you for doing that. We did see in the course of the response, we asked if people knew somebody who was hospitalized or had passed away from COVID-19. And most of the folks who responded to the survey did. So I think people are feeling the impact of COVID-19 in the community. I myself experienced that loss in January. My mother-in-law I'm going to start getting teared up here, on January 6th, let us know that she had been diagnosed with COVID. She was very quickly admitted to the hospital with breathing problems. It was looking good for a while there until it wasn't, and she passed away by the end of January. So vaccination, she had even talked about getting vaccinated in December. She was looking forward to it. And now I think it's an important conversation for all us to have to say, what do we need to know about vaccination? Is it right for me? Is it important? Is it right for the people that are around? So I'm going to turn it over to the folks leading the conversation in the community. First off, Regina Carswell Russo, who is working with the Regional COVID Communications Center. And you probably recognize her from Fox 19 as well over the years. And Dr. Nita Walker from UC Health. So Regina and Dr. Walker, thank you so much.
Thank you,
Absolutely.
Michael. First of all, I want to tell you, thank you for taking the time to allow us to come to speak to your team today, especially when you're in the middle of processing and dealing and healing in this incredibly difficult moment. I am so privileged to be able to provide this for you, and I just want to say thank you. And we had a conversation before about your family, and we're here for you. So just know that we're going to be wrapping our arms around you. So I want to welcome everyone here today. Regina Carswell Russo. I'm founder and CEO of Right Now Communications consultancy that has been hired by the Chamber and the Health Collaborative to lead the Regional COVID Communications Center, elevating and amplifying COVID prevention strategies for the region to help people live, work, and play through stages of this pandemic. It is really, seriously, this is 45 minutes well spent. This is just hard-earned currency that you're going to have and walk away with you today, because I have the pleasure of introducing Dr. Nita Walker. She joined UC Health back in 1992 and is currently the associate professor, is that correct, of clinical medicine in the Department of Internal Medicine. She's received her formal residency training at the University of Cincinnati Medical Center and serves as chief medical resident and elected to Alpha Omega Alpha Medical Honor Society. Dr. Walker is a graduate of Smith College and the Medical College of Georgia. One thing that's in her bio that you should know, it says here that Dr. Walker, her patients have been with her for 20 years. And the reason why I say this is because if you have a patients, that's plural, families that have been with you for decades, that means that you are well researched, you provide excellent customer care and service, they trust you in confidence. And that is who we have in front of you today. You can trust, have confidence in everything that Dr. Walker is going to present to you today. So I'm going to introduce Dr. Walker. Let her start off with some high-level things that she wants you to know, that you need to know. I'm going to jump right into those questions. Dr. Walker.
Excellent. Thank you, Regina. And thank you, Michael, for the opportunity today. And Michael, you know, my condolences to your family. Actually, COVID's impact has been huge. And it's not just the people who died from COVID, quite honestly. I just left a family funeral in Maryland. I'm not in Maryland, I'm in Cincinnati today. Because the impact of COVID is that sometimes what happened is some of the people didn't die from COVID, but they died because of what COVID wrought. which is the big concern about COVID. And what's happening is that it has limited resources around not just our country, but countries around the world. So that's one of the things you should know. When we think about what COVID can do in a community, it's also about what it causes in terms of the impact, because resources aren't available. So that said, I'm going to transition. And for those of you who have lost family members to COVID, again, my condolences. It has been a very difficult year. The losses have been so much, again, because of directly from COVID, or indirectly because of people who weren't able to get services and things that they needed because of the overwhelmed community and medical system. So the three top things that I want you to know is, number one, vaccines have been very important to improving population health over the past 100 years. Vaccines are not new. The first vaccine was actually administered in actually 1796, so over 200 years ago, by Edward Jenner in England with smallpox. That was one of the biggest scientific breakthroughs, period, because we finally had the opportunity to take an infectious disease, which were devastating in the world at that time. There would be outbreaks of all types of things all over the place. So vaccines have made a huge impact on public health and population health in the world for over 200 years. Almost everyone on earth has benefited from vaccines. Even if you don't take vaccines, you still do, because other people taking vaccines allows you to be healthy and safe. And I'll give everybody a chance to mute. Great. And then the other thing is, there are many people with chronic health conditions, including vulnerable elderly and children, who can't take vaccines or who get exposed to diseases and die, even though we have improved a lot of our science. So they depend on all of us taking vaccines to protect them from deadly consequences of infectious diseases. We've all heard about herd immunity. We like to think of it as population immunity, because herd immunity confuses a lot of people and think that it's all about just getting the disease naturally. But the problem is getting the disease naturally. That means that we think it's okay for a subset of people to die, because people do die from diseases. And unfortunately, with COVID, we're well over 550,000 people who died in America. And we're unfortunately, we thought this year we'd see even less, but we're continuing to see about 1,000 people a day. And sometimes in some months, up to 3,000 or 4,000 people a day who die from COVID. So the other thing to know that I want you to know and take away, that there's been a lot of confusion about science over the past year. And I think one important thing when you think about science is this: science is a process of learning by layers of knowledge. We all think of science as amazing Big Bang discoveries, and those happen. But many of those discoveries are really built on the layers of knowledge that have occurred over time. So it's really important. And that's important because a lot of people are very concerned about, how did this vaccine come about so quickly? But remember, it was layers and layers and layers of knowledge. Think 1796, Edward Jenner, layers and layers of knowledge. So what we learn from one experiment leads to more, and that ultimately leads to answers and bigger discoveries. So the important thing is, vaccines have saved billions of lives and make our world safer for us all. And without them, we really wouldn't be able to do many of the things that we take for granted right now. So I'd like to transition to your questions. I think, Regina, are you going to field those questions or manage them?
Yes, I am. And so first of all, I just want to remind anyone, it's a little bit of housekeeping. If you have your not speaking, to make sure that you're on mute. If you have to get up and get something, the mailman, your dog, get your kids on online learning, whatever, make sure you put your video on mute and then come right back, okay? And I think we're recording this, so if you miss anything, we're going to give it to you later. So before we get to J&J, because I know that's the first thing on everyone's mind, I do want to go back a little bit, right? So first, let me ask a question, and I want to see a raise of hands. I only see part of some of these people, but is the reason why some of you and some of your friends and family, you don't feel like you should be getting the vaccine because you actually do feel like it's just came about too fast? Any raise of hands? Anybody? I see one. I see two. People think it was rushed. Okay, so I'm going to go back to that because I want you to really understand how this came to be. So, Dr. Walker, this is my understanding. One, we didn't start from ground zero. We had SARS. SARS we had been affected by that. So we already had a working knowledge of a virus that is similar to COVID. One. Two, the technology. The research and technology had been there for so long. Again, we're not starting from ground zero. So it almost was timing that was able to bring technology and research and knowledge that we already had. And then 3, this never happens. When you're developing a vaccine, either you don't have enough people that want to be in the trials because, if you're not worried about getting rabies, you're not going to be in the trial to see how a rabies vaccine is going to affect you, right? But everybody in the world was affected by this. This was a global issue and the world had shut down. And so monies were free flowing for the research. There was no stopping it. There was no bureaucracy. And so the gates were open because if it wasn't, the world could not continue to operate. Can you kind of expand on some of those points?
Absolutely. And you're 100% right about SARS. The other thing is there was MERS. So there was SARS and then there was MERS. And if you remember those 2 viruses, they occurred back in the early 2000s. And so about 2003, and then we had the other viruses in follow-up. Both of those were coronaviruses. So people really began studying how to, and those epidemics did not get to America. Amazingly, they didn't at that time. Interestingly enough, we do believe that the expansion in travel that occurred after 2000 in the 2010s probably led to some of what has happened. And then we'll talk about, travel and how people feel comfortable and think about that. But you're 100% right that the science didn't occur overnight. The mRNA, you've heard a lot about mRNA, and we'll talk about that if you want to, but that was already being studied because of SARS and MERS. So a lot of the science was there. Remember, I talked about science being layers. So there were layers that they were already working on. It just accelerated because, like Regina said, everybody was more invested in it. All around the globe, there were government. There were philanthropy. Everybody came together and said, we've got to put our best thinking around this. Let's look at all the available knowledge. We have got to get something to stop this from spreading around the globe. If we don't stop it, we'll have even more death and destruction.
There wasn't an issue with financing, the research and getting things going. Even Dolly Parton just got in her crystal bag and pulled out $1 million to get some of the research, right? So you imagine how many other people came to the table to make sure that this happened. And not to mention, let's talk about this, about efficacy, right? Because of the thousands and thousands and thousands of people who stood up to be a part of the trials. Talk about why that's so important, because people don't want to take a medicine other people haven't taken, correct? But if you're in a trial phase and you have a range of people that are taking the trials, they can test and see how the vaccine works on different people, if you have a chronic illness, your history. So that was another reason why Moderna and Pfizer came out with 90%. That's unheard of efficacy. Flu shots. Listen, I'm talking like I'm an MD because I've been doing this work for a year now. Don't want to, But Moderna and Pfizer, because I find it so interesting, Moderna and Pfizer, efficacy was super high. Normal efficacy for vaccines like flu was 70%. 70%. So
70%. That's right.
So talk about that.
So you're right. So normal efficacy. Now, the thing is, what everybody should know, 70% is very good efficacy for a vaccine, okay? And some of us on the line are old enough, well, and I'm not actually old enough to remember this, but some of us on the line are old enough to talk about the fact, and remember the Salk vaccine, okay? The polio vaccine was invented in Cincinnati, all right? We have Sabin Way is named for that. Jonas Salk, they were Cincinnatians. They lived in North Avondale. So, and the polio vaccine was a huge differentiator for our parents. Our parents didn't go swimming because of the polio scare. So it changed their lives. And that's why I found that it's very interesting. A lot of people over a certain age remember that. And so I think one of the reasons why we've had tremendous uptake among older patients and patients over 65, because right now we're seeing their vaccine uptake 60 to 70%, and in some populations about 85%. Notably, some groups have organized, notably our Navajo Nation, and then the First Peoples up in Canada have organized to protect their elderly and protect their language, because those are the people who are keepers of their culture, and they have achieved 100% vaccination of the elderly. People remember the polio vaccine. They remember standing in line. They remember in Cincinnati that they went down to various places to get those shots, because that was such a difference. They remember people being paralyzed. They remember their friends being paralyzed. And there are still people who have post-polio syndrome who are around. So the reality is, like you said, it's very important to understand that clinical trials are very important. These trials enrolled a lot of people faster. We have a lot more technology. It's easier to communicate and get people. I know people who personally were in the trial. A lot of people who were in trials tend to be medical personnel. So I know many doctors who enrolled because they're the first ones who find out and they're willing to do it. One of the things that everyone should know about a clinical trial, there's an incredible amount of monitoring in clinical trials, an incredible amount. You are constantly getting back information. You're constantly meeting with your trial coordinator. So that's, and the good news about that is then you find problems. So that allows me to segue into J&J because it's on top of everybody's mind. So what's going on with the J&J vaccine? So what's happening with the J&J vaccine is exactly what is supposed to happen. There is a process for vaccine reporting. So the process worked. So those events occurred. The physicians recognized that those events could possibly relate it to the vaccine. They reported it. You go online and you report that. Then they reported it. J&J recognized that they had a problem. They reported it to the government. Okay. Everybody's doing what they're supposed to do. The government said, let's take a pause. Nothing wrong with taking a pause because science is an iterative process of layers of knowledge. And until we understand that those events are related, and then the investigation starts. So suspension there might have been a different word they could have used because pause is what's really appropriate. Take a pause while we investigate what's happened. Because often people will attribute something when it's not, it's just a coincidence. And so you have to take time to investigate and understand what's a coincidence and what's really the cause. So one of the things that you really have to understand is that lots of things cause blood clots. The number one thing that causes blood clots is actually smoking. Now, there are a lot of inherited diseases that cause blood clots, but a very common thing that can cause blood clots. So an investigation has to be done. Were these patients smokers? Were they on birth control pills? They all happen to be young women. So we need to because if you smoke and use birth control pills, your incidence of clot goes up dramatically. So we really have to make sure all of that's going on. So it's an appropriate thing that should happen. And it means that the system actually worked the way it's supposed to because people reported. That's the first part of the process. Then once they saw something was going on, they said, let's pause. That's the second part. And then the third part, let's do the investigation. They will let us know within a few weeks. Maybe, I'm sure they'll be accelerated, but within the next couple of weeks, we'll know if these are really related.
Optics, and show of hands, when you guys heard that last night, how many of you were like, I told you so, I knew something was up with this vaccine. I'm not quite sure I want to, yes, right, Ms. Smith, I know you did, because of optics. And because when we get information, whether it's on social media, on television, with the water cooler, you're getting glimpses of it, you're getting short amounts, and you're not getting the whole context, right? This was 7 women out of 7 million people who had the vaccine. Context, 6 or 7 out of 7 million. And for a pharmaceutical company and the CDC and the government to say, those 6 incidents need to be investigated and we need to rule out anything is extraordinary and also speaks to the care and the intent of making sure that everyone knows that these are safe vaccines. What would you think? Do you think that's the case? I mean, because there's an argument that was a little heavy-handed to suspend and to pause, but an overabundance of caution, they were trying to send another optic that we're trying to make sure everyone knows that we're taking this seriously.
So the good news is, again, our country has a pretty good process in terms of reviewing medications. This is not uncommon. Medications will be reviewed and paused all the time because the FDA will say, wait a minute, something happened. We need to make sure it's not related to the medication. This is the way it's supposed to work. And so the process is working exactly like it's supposed to. There have been vaccines in the past where something came up, notably back with the swine flu, when there was Guillain-Barré. And so again, there was a pause and said, wait a minute, let's see if this is really related to the vaccine or if this is related to something else. So, and part of it is you have to make sure it's also not related to Is it components of the vaccine itself, or is it things that are used in production? There are all sorts of things that have to be teased out and figured out. So the process is working. Everyone should feel reassured. Have there been times when it didn't work right? Yeah, occasionally. Unfortunately, it doesn't. But the good news is there's a lot of oversight right now, and the process is working exactly the way it's supposed to work. Similarly to what happened with AstraZeneca over in Europe, the process worked. If everybody does what they're supposed to do, we often say, I have on my whiteboard in my office, trust the process or create a new one. So you probably understand the same thing of what I'm saying here. If you don't trust the process, that's okay, because we have to constantly reevaluate the process and make sure it's working. We should all be doing that. Then let's create a new one. In this case, I do believe that the process worked.
I want to reiterate here for everyone on this call, this is your session. And we are not here to sway. We are here to give you the information that you need to make informed decisions, and to let you know that Dr. Walker and the entire medical community understands the reluctancy and hesitancy of people when in this really kind of uncertain time. So we're going to just give you as much information as possible. And to that end, I'm going to get to the questions that you provided us and then open it up for all the questions that you have here. If you have any other questions you want to put in the chat, go right ahead. And then we will also follow up with any questions that we did not answer. So here we go. Will we have to get a COVID vaccine annually, Dr. Walker?
Right now, we don't know. So possibly. So far, coronavirus may be acting like the flu, and many of you know we have to get the flu shot annually. So I suspect that we will potentially have to get this annually, but right now we don't firmly know. So far, we're seeing that the antibodies do last about 6 months, but what we don't know is how quickly variants will emerge. The flu, think about the flu. COVID and the flu have a lot of parallels. The flu, every year, what happens is they look around the whole globe and say, these are the variants we're seeing around the globe. Then they collect that information, run it through all of their fancy technology and machinery, and then come up with the flu shot that you get. And it protects you against all the variants that are out there. So COVID and the flu may have similar behavior. They're showing that they have some similarities. And so we may be in for an annual shot, but we don't know yet. I suspect that we will know a little bit more by maybe fall or January.
Okay. I'm going to ask that everyone continue to be on mute. So people are saying, some of my friends and family say they're just going to wait to see how this plays out, to see if my family and friends get any adverse side effects before I get vaccinated. So they're on pause right now. What do you think about that? Is that a good approach or not a good approach?
The reality is, if you choose to hold and wait, here's the reminder: wear your mask all the time. Okay, there is a way. If you decide that you're going to just not do a vaccine, put your mask on 100% of the time, and stick to the guidelines. And there are some people who will have to do that. And one of the things I always remind people: you get vaccinated not just for yourself. You get vaccinated for those people who can't get the vaccination. That is the whole reason I take the flu shot every year. Is because I don't want to give the disease to anybody. I see lots of patients, people who have transplants, immunity, but if you decide you're not going to do it, there's a way. So here you go.
You talked about variants. How effective is that Pfizer vaccine against the variants that keep popping up?
So the good news so far is that all 4 vaccines appear to be very effective against the major variants identified. Now, that doesn't mean there won't be new variants coming along, but so far, all of the major variants that have been identified, the vaccines seem to be effective against.
So here's a good question. How do the vaccines actually work? How do they lower your risk of getting ill effects from if you are exposed to COVID?
So this is kind of cool, and I won't go too deep into science, but so this all goes back again to 1796. So you take a little piece of the virus, and then he injected it into little sores, and then the body reacted to it. So your body has its own immune process. So if you get COVID naturally, your body's immune process will kick in. Now, for some people, that process, your body's process is not so good. Our immunity gets a little, just like every part of our body gets old, our immunity can get old too. So that's why older people are vulnerable. If you have diabetes, your immunity can get impaired. Right now, we have lots of people who take medications that they absolutely need for autoimmune diseases, and then their immunity is impaired. So what happens is the virus, when we do a vaccine, we actually use your existing immune system and process by giving it a little piece of the virus. The mechanisms, we don't do what Edward Jenner did, which is take the sore out of somebody else and then stick it in a person. We're beyond that, but we take different pieces of it. So for Pfizer and Moderna, it's the messenger RNA. In fact, if you look at Moderna, MODERNA. So that's what they're saying, RNA there. That is just a piece of the genetic code of the virus. Other vaccines use the entire virus. Some use the entire virus. We don't do that quite as much as we used to because the science is better. And also, if we give people a live part of some virus, they might get the disease, particularly now that we have so many people who are immunosuppressed. And then J&J actually uses what we call the spike of protein. They actually use the spike to create. So what you do is you inject that and then train your body to develop its own antibodies. And so that if you see that, once you have those antibodies, then it will attack it once it gets in your body. If you happen to get coughed on by somebody who has the vaccine, your body already knows what to do, and it can neutralize or kill the virus. And that's simply what it comes down to. It's basically taking advantage of existing memory.
So let's get some clarity on that, because some people are like, I know you're not injecting me with COVID so that I don't get COVID. Are you injecting what mimics the virus? Is that how that works? You're injected with pieces of the virus, or some of it are things that actually mimic the virus. You're right. Now, there are different processes, and I won't go too deep in the science, but no, we're not injecting you with the active part of the virus. We're injecting you with some pieces of the virus that will help your body understand what the virus looks like. So this shouldn't make you sick with the virus. And so far, we haven't seen that, which is good. That was a very important part of the trials, and that's why they do trials. And before they even get to trials with people, they did these trials to make sure that the actual vaccine would not cause the disease. That was a problem in the past when they were doing, like Edward Jenner, whole virus. So we've been there, done that. So we don't do that anymore. So now we just use different components. Yes. Go ahead. I'm sorry. So Pfizer and Moderna and J&J, why are two shots, and why is J&J just one shot? Again, J&J is a slightly different vaccine. Because of the way it develops immunity as opposed to the others, then it was required to get to a threshold of 70%, and they were able to achieve that with one shot, whereas the other two were not able to achieve it with one shot. So it's just a matter of the different processes that were used. So it's kind of like when you get the shocking, I'm old enough to get the shingles vaccine. So when you get this shingles vaccine, you have to get two shots. You have to get one, and then it's kind of like a booster. It's kind of the same thing, right? With Pfizer and Moderna, right? Right. Perfect. Every virus is unique. Every virus is unique. So some you require only one, some you require two. Or three. So here's the thing. This is a good question. Does the vaccine prevent you from getting COVID, or does it prevent you from falling seriously ill from COVID? Because that's the thing. Our understanding is that if you get the virus, it prevents you from having to be in the hospital succumbing to it. Not that you will not completely be exposed to it or get it. Is that correct? So it does all of those things. We do think that it prevents you from getting the virus. More to come on that, because again, we're learning whether or not this is really a big thing. But most importantly, and the most important thing it does is and we also know that if you get the disease, you'll have less complications. But the most important thing is we know that you'll not get hospitalized, and it prevents hospitalization, and it prevents death. So that's what we definitely have seen with those who've been vaccinated. It's a good, and we have some real data on that now beginning to emerge. England's a little bit further ahead than we are with vaccination. We're at about 30-something%. England's approaching 50%.
they have already seen a reduction in COVID dramatically in parts of the country where they've had heavy vaccination. So we do believe that there's going to be evidence that it actually prevents the spread of the virus, not just prevents hospitalizations and death, but actually prevents the spread of the virus.
That's great news. That is great
That's
and
hot off the
hopeful
press.
news.
That's
Oh,
hot off
good.
the press.
Okay, I'm writing that down right now. That's perfect. I love that. I love that. And everyone can, you should do your own independent research on this as well. Take some notes and write some of these things down and do some additional reading so that you feel very confident about the information that we're giving you. This is a great one. So should everyone in the house who's getting vaccinated get the same type of vaccine? Should everyone get Pfizer, or can some get Moderna, some can J&J if you live in the same house?
Get the vaccine you can. I don't think it really matters. I think get the vaccine you can. They all are equally effective in preventing severe disease and death, and that's your goal. And I would also say for those who have additional questions, cdc.gov, just that simple, has great information on any question you may have about COVID in general and about so many other things in terms of related to disease in this country.
When do you know that you are fully vaccinated? Does that mean that you don't have to wear masks around other people anymore and wipe your groceries down and stay 6 feet away?
So a couple of things. One is you really don't have your antibodies. It takes about 2 weeks in most people to develop antibodies. What we do know is that a subset of people, about 6 to 10%, and in older people, maybe about 20%, may not, based on flu experience, may not develop antibodies. So what we would recommend, here's what we recommend. You can probably stop wiping your groceries down, because I think we've determined that there's probably not a lot of surface. The surface early on, the reason why those recommendations were made, and remember, it was the right thing to do based on the science you knew at the time. Early on, those recommendations made sense because in hospitals, they were seeing overwhelmingly sick people who were spewing lots of COVID fluids everywhere, and people who touched those surfaces got sick. So made sense at that time for that recommendation, but now we don't think you need to wipe your groceries. You should do your routine sanitization. Now that's it. We could probably all do a little bit more sanitizing than we were doing before COVID. But here's the bottom line. It's probably okay to gather in small groups with people who are similarly vaccinated, not with the same vaccine, but who have been vaccinated. But personally, I've been vaccinated for 3 months. I'm still wearing this, okay? Because I know that the vaccine there's always a chance I could still get it. This should really not go away depending on where you're going. If you go into certain places, or if you look and let's say you decide to travel to, I hate to pick on a state that has low vaccination, or let's say you decide to go to Michigan right now and they have actually decent vaccination, but the virus is surging there. I'm going to wear my mask. If I go to a hot spot, even with my vaccination, I'm going to wear my mask, because I know that while I very likely have plenty of antibodies, I still think you should wear your mask. Well, so some of it's going to take a little bit of thinking about what you're doing.
It's new healthy habits, right? We're eating fresh foods, we're exercising, we're getting vaccinated, and we're moving our bodies, and we are wearing our masks and doing all the things that are helpful that got us through the pandemic that we can continue to carry with us as we emerge through it. One last question, or a late question rather. Someone who completed the Moderna vaccine several weeks ago still is experiencing soreness on the injection site, never had that before, and didn't know what might be causing it.
So great question. And actually, when I got my second vaccine, I had a little bit more pain. Sometimes it's not necessarily the actual vaccine, but sometimes sometimes injectors inject it fairly low, and then I find that's when patients tend to get more pain. So what you may want to try, but I would certainly reach out to your provider. You should have a primary care provider. If you don't, make sure there are lots of ways to contact one, but I would certainly recommend that you can put a warm compress on that, and that can help as well. But we have seen that particularly because right now, sometimes it gets invented, and it doesn't mean that they did it wrong. It's just that bodies are different. And so, I would say, I suspect this is sometimes with a woman, we don't have as much muscle in our upper shoulders. And so we notice things a little bit more and for longer than men or people who are more muscular in the upper shoulders. So,
Michael's just put this in here. Flu rates super low this past year. Super low. We didn't see, I don't think anybody got the flu. I don't remember anyone getting the flu this year. There weren't a lot of coughs in my house. Nope. No runny noses. No any of those things because, of course, the face coverings. Do you think that
yep.
we'll keep doing masking as a guidance during flu season next year and just kind of continue to carry this with us? They've been doing that in other countries for a very long time.
Absolutely, Regina. I'm glad you pointed that out. Asian countries have been doing it for quite some time. Japan is well known for the fact that during flu season, people wear their mask continuously. We talked about this in our office. There are 7 physicians in my office, and we talked about this the other day. We said because we saw that the staff stayed healthier, yes, we are going to make sure that they continue to mask up during the season. And we always do. If we see that, or if someone calls ahead, or we see that someone has a certain disease coming in, we mask and gown up. So we've always been doing that practice. If we think that there's risk, we go ahead and do it. It's pretty important for everyone to, and so we are very excited about the fact that there was less flu this year, because we had one year not that long ago where 100,000 people died from the flu. And so I think that there's no question that we should continue to mask up when we think we have diseases in our community.
I'm going to tell everyone that I have a web page in the chat, testandprotectcincy.com. You can go to that web page if you want information about getting a vaccine. They are plentiful right now, and it is we have lots of easy ways, removing barriers to people who want to, with convenience, get a vaccine. You could go there and find all the information, and then you can also flip over to the RC3 page that has guidance, information, FAQs, anything else that you may need. Another question. Teenagers, 1, which vaccines are approved for teenagers? And 2, what about children and infants? When are they going to be able to be vaccinated?
So right now, 16 and up, the EU emergency use authorization for the vaccines includes 16 and up. So if they're 16 years old, they can go to Test and Protect Cincy, or they can call CVS, or they can call UC Health, or any of the number of places and get the vaccine. And if you have a child who is going off to college and going to be in a congregate setting in a dormitory, get the vaccine. I've known a college student who died this year. My pastor's nephew in Pennsylvania, on the football team back in September. So if you have a child who's going to college, I'd say give some serious consideration to doing that. One of the things many colleges are giving an early indication that they're going to require the vaccine to come and live on campus, because an outbreak in a congregate setting can be a disaster. In fact, notably, one of the biggest congregate settings we've had in America where we've had some serious outbreaks has been prisons. And in fact, finally, many states have moved quickly to try and vaccinate that population, but it's extremely important that those who will be in congregate settings. So for children, Pfizer is testing right now. They are actively enrolling. Children's Hospital is participating, and they are actively enrolling, and we hope to know if we'll be ready to vaccinate children by the fall. I do think it's going to be interesting where we stand with that in the fall, and infants as well, and we'll know more. But I think if we're going to fully get children in school, if you look at the New York Times, Ezekiel Emanuel has a very good article about that. It's going to be very controversial. He calls for a mandate. And I know that many people will bristle at that, but the reality is that if we're going to bring children fully back in school, we have got to think of a way to do it safely. Otherwise, we'll be whack-a-moling all year round. We will be whack-a-moling.
I do want to, Michael, I think you wanted to say something, but I did want to call out, of course, UC Health is a leader in this area of providing this information and research, and has so many just extraordinary health experts. Tamara, do you have a website that maybe we can put in the chat if people want to reach out to UC Health, to a webpage to get information about the COVID-19 vaccine?
Absolutely. I'll stick that in the chat now.
Thank you, Ms. Tamara. I appreciate it. So, Michael, how much time do we have left?
Well, we've got about 5 minutes left, and I don't see any other questions coming, but a good point about just accessing vaccines. A lot of the people we serve at Easterseals have transportation barriers, and we just got information today that United Way, through their 211 service, will be providing free transportation to folks who need it to get their vaccination. So
Yes.
another great example of the community coming together. And I did want to bring in Pam Green really quick, so she can help us wrap this all up. She's our president and CEO. So we will get her unmuted, and
Hello.
there she is.
All right. All right. Hi, Regina. It's so good to see you. And thank you and Dr. Walker so much for joining us today. And thank all of you for being here. I know we have a lot of folks that are looking forward to the recording as well. I see Latasha Makeupson is here with us, and I don't know if Regina and Dr. Walker know, or if all of our employees know, that Easterseals has actually played a really important role in Operation Warp Speed, because our facility here on Gilbert Avenue, we're involved in clinical tests, the clinical trials industry. And so we have been building Pfizer COVID tests out the wazoo this year. And we're now doing some tests for some of the variant vaccines. And so our employees, the veterans and economically disadvantaged and the folks with disabilities that are employed in our production center have been on the front line of developing the solution through vaccines. So we're really proud of that work. So I want to brag about that for just a minute, so that as you all are out and about, you can tell folks that some of that work is actually being done right here in a different way as part of the supply chain. I just want to say it's been really informative. I feel like I thought I knew everything about COVID because I read about it constantly, because maybe I'm just a little paranoid, but I learned so much today. So thank you guys. Thank you both so much. I put in the chat, I did not realize my daughter is in nursing school. And so she told me that she didn't want J&J because she wanted an mRNA vaccine, which I had no idea what that meant. So not only did Dr. Walker inform me, I learned that Moderna was short for mRNA, which I didn't know. So anyway, I'm really proud of the way that our agency has responded, and our employees have responded to keep ourselves, our coworkers, and the individuals that we serve safe during this time in ways that helped to protect jobs and serve our community. So this is just one way. I hope that you guys share the things that you learned here today with the folks that we serve and the resources that are available. Thank you so much to our Safe at Work committee and Michael for organizing this. And did we not have two of the most engaging speakers and presenters today? You guys were just awesome. So thank you so much.
I just want to jump in very, very quickly, because and then be respectful of your time. But the one thing I just want to assure everyone, because I'm in the business of communicating these very difficult and delicate messages, is that it is okay to have doubt. It is okay to have fear. It is okay. That means you care. You care and you want to know. And so just keep reaching out for more information. And the thing about fear is that fear may not go away. You just have to continue to walk through it. And you walk through it by getting as much information as possible. And there's going to be people every step of the way to walk with you until you get to that point to make the best decision for you and your family. And I say that from all points. Even when you're there to get the vaccine, some people hate getting needles, they hate the whole process, it's crazy. There are so many caring people who are there who will walk you right through it, and you will be relieved after you have finally made the decision. So I just want to encourage you with that. So thank you for your time. I just really appreciate it.
That was awesome. What a great way to close, Regina. What a wonderful.
And if we have time, we got one last question for Dr. Walker. Does the COVID vaccine prevent or have any effects on trying to get pregnant or pregnancy?
That's a great question, because I know that there's a little bit that's been floating around out there about the vaccine causing infertility. We've not seen that with any vaccine, and so far not seen it with this particular vaccine. And let me assure you, since healthcare workers and a lot of frontliners, I think plenty of them have gotten pregnant since they've been vaccinated. And so thank you. I just want to say thank you to your team for all that you're doing. You do incredible work. We appreciate you. So glad that you're willing to have this conversation, and don't hesitate to reach out if you have any additional things you want to know. Michael can get those questions to us, and we're happy to give you the information.
Thank you both so much for joining us. And we'll be sharing the recording with our employees and hopefully getting the good word out about vaccination. Get out the vax.